Hello, everyone, and welcome to my podcast. I'm nursing theorist Patricia Benner. Please welcome our 5 nurses here for a discussion panel. We will be reviewing my nursing theory, the novice to expert. I will be posing a question to the 5 nurses on this panel to review what that would look like in an applicable nursing clinical setting. So the question I pose to these nurses today is, your patient has high blood pressure. Now what? Hi, I'm the novice nurse. I have no idea. I'm just happy you guys asked me to be here. Hi there, advanced beginner. I do know that I would be looking for certain signs and symptoms for high blood pressure, but I personally have never had any experience or patients that have had high blood pressure before. But I do know I could look in my clinical nursing resources for the examples. Hi there, I'm the competent nurse. I do know the signs and symptoms of high blood pressure, but sometimes I'm a little slow to make that connection just because I don't have the experience as some of the other nurses do. But I do know I'd be checking vital signs, and if I did have any other questions or comments, I would ask a nurse that was a little bit more experienced. Hi there, I'm the proficient nurse. I've seen this before actually, and I do have a lot of patients who have had high blood pressure before. So there are additional questions that I have because I'm looking at the patient as a whole, not just the blood pressure itself. So I would have questions such as, is this patient blood pressure normal? Are they taking medication for blood pressure? Is this a new onset of blood pressure that I might be concerned about? Hi there, I'm the expert nurse. I've had a lot of patients who've had high blood pressure. As a matter of fact, I found out about the high blood pressure because this patient complained of having a little bit of a headache, and something in my gut told me that perhaps I need to check their blood pressure. It's just nursing intuition. Thank you so much for your input there, nurses. So as we can see, our novice nurse begins with little to no experience and not able to make those connections to those possible signs and symptoms, right up into that experienced nurse who is able to depend on her intuition, know guidelines like the back of her hand, and is able to make those smaller connections based on her experience being on the nursing floor. So I hope you enjoyed the experience of the novice to expert model, and I look forward to our next podcast. Thank you.